Refit, powered by reaction.
I used to weigh more than 120 kilos.
I was so overweight. I wasn't able to play with my kids.
I'm going to be 60 years old next year, and in advance of that celebration, I lost 100 pounds.
Cuando pesaba 160 kilos, me resultaba muy difícil conseguir ropa.
After losing 54 kilos by changing my eating habits and exercising, I started to look for a solution for my sagging skin.
Even with the weight loss, I had a lot of loose skin. It appeared to me that the only option I had was surgery. It would have taken significant expense and significant downtime.
A friend told me about a great solution that would tighten my skin.
Me operé de bypass gástrico y bajé 65 kilos en un año, pero la piel quedó donde estaba. Ni siquiera con deporte pude modelarla.
Refit was specially developed by Viora to treat lax and sagging skin using proprietary and advanced core technology. Refit is a non-invasive solution with no downtime or anesthesia needed. Safely heating the dermal layers, Refit causes the underlying network of collagen and elastin fibers to shrink, restoring the skin's elasticity.
Using the Refit protocol in my practice allows me to treat patients with excessive loose skin who have had extreme weight loss, whether it be from childbirth, surgical procedures, or plain old diet and exercise. My patients enjoy easy, painless treatments, and they're very satisfied with the results.
After treatments with Refit, I feel like I've completed my weight loss journey. I'm motivated even more to keep the weight off.
I had 8 Refit treatments, and I am very happy.
Ahora estoy a mitad del tratamiento de Refit en Viora y estoy muy contento con los resultados. Estoy muy ansioso por ver cómo quedo al final del tratamiento.
I'm only halfway through those treatments, but to me it's just a miracle. Without any pain, without the downtime or expensive surgery, there's significant improvement already, and I'm just delighted with my treatments.
Refit, your ideal solution for addressing lax and sagging skin. Speak to your practitioner to learn more about Refit. By Viora.
Viora is proud to present Reaction, the only aesthetic device of its kind to offer the freedom of multiple radiofrequency energy and the added benefits of vacuum therapy. Reaction, the new dimension in aesthetic treatment. Reaction goes beyond single frequency limitations to redefine aesthetic treatments for unmatched results in skin tightening, cellulite, and circumferential reduction. Multi-frequency and vacuum therapy, the core advantage. Reaction's patented core technology advantage lies in its choice of 3 different frequency channels, a multi-channel option, and the addition of vacuum therapy. Each of the 3 core frequency channels precisely targets a specific skin depth. The multi-channel mode travels through all dermal layers at the same time and simultaneously covers the full treatment depth. The freedom to choose the channel mode according to the treated body site allows a more accurate treatment that optimizes clinical results, speeds treatment time, and ensures client safety and comfort. Skin tightening. The human body is a complex of varying skin depths and characteristics. A single frequency treatment cannot, by definition, treat them all effectively. Reaction's multi-frequency channels, however, offer an unmatched degree of control to precisely structure treatment parameters. Accurately targeting skin depth with the frequency defined for a specific area of the face or body ensures the exact energy levels needed for optimal results in all regions. Reaction instantly contracts tissue fibers and stimulates neocollagenesis for immediate smoothing and tightening results. Body contouring and circumferential reduction. Subcutaneous tissue in larger areas like the thighs, buttocks, and tummy require a more intense treatment. Cellulite in these areas is often caused through a chain reaction of weakening dermal collagen, enlarged fat cells, and edema. Through its multi-channel RF mode and vacuum therapy, Reaction safely distributes thermal energy to fight cellulite at its source. Superheating of subcutaneous tissue on multiple layers builds collagen to strengthen the dermis against adipocytes and stimulates lipolysis to shrink fat cell volume. The increase in collagen also results in a side benefit of skin tightening without the need to change applicators or settings. Vacuum therapy enables deeper penetration of RF energy, reduces edema, improves blood flow, and stimulates the metabolism. The reaction that makes all the difference.
Hi doctors, I have 3 beautiful kids, but they left me with this loose, saggy skin on my stomach. Should I get a personal trainer and hit the gym even harder? Or should I talk to a plastic surgeon about a tummy tuck? Or is there another doctor that can help me take care of this less invasively?
Well, Dr. Sandra Lee is back with her patient who you just met in the video. Kelly, how are you?
Hi, good.
And so the question is, we're talking about loose skin after pregnancies. So who do you go see? What kind of doctor for loose skin in your tummy? Is it the plastic surgeon or is it the dermatologist? Potentially both. So I had the opportunity to examine you before we started the segment. I mean, you are buffed. You are in good shape, but you have that loose skin. And unfortunately, no amount of diet and exercise is going to cure that. So, there's a number of options that you can do, and I think you did all the right things leading into your pregnancy, during pregnancy, and after. You took good care of yourself. You're going to the gym now. Your muscle tone is great. So you've done that option. Number 2 is coming to see me as the plastic surgeon. And you are a good candidate for a tummy tuck. And because you're so in front, we could do what we call a mini tummy tuck through a small incision like that, tighten those muscles, and just remove that little bit of overhang. So that's the second option. But finally, that's where Dr. Lee comes in. We have so many great non-invasive or minimally invasive procedures to get some skin tightening.
If somebody doesn't want to go through a more invasive procedure, if they don't want to have surgery. And I really have here the newest and the greatest of all the radio frequency devices. This is Reaction by Viora. You're able to treat at multiple frequencies, and so you can be more specific with the depth in which you're treating with this device. You can treat cellulite, you can tighten skin, and it has vacuum as well, so you can suck the tissue up and you can even penetrate more deeply. And we can even use a specific handpiece here to actually target stretch marks as well, so we can help to improve stretch marks.
So it's twofold. It's getting some tightening and also having stretch marks. How's that sound?
Let's try it, right?
And you're going to do a little bit.
Let's fire it up here. Yes, we're going to show you what it's like, and you're going to be so nice to hold the temperature sensor.
And this is the temperature sensor because it's so important.
You can see how it's vacuuming up,
it sucks
pulling
it
the
up
skin
in
up
there,
into
pulls
the
it
area.
in.
And we can go back later and change the handpiece and actually directly try to improve the stretch marks as well.
How's it feel?
It feels like someone's pinching me,
so,
but not hard.
Kelly's a good candidate.
Yes, Kelly's a good candidate because she's already so fit, and we just have this one trouble area, and also because she doesn't want to go through a more invasive procedure. And you can use this to treat all areas of the body. The neck is a very popular area, the thighs, the tush. So it's really just a great and easy way to no downtime.
How many treatments is she going to need?
6 to 8 treatments, really spaced every 2 weeks, and it's about $1,200 to $2,000 for the package, like for 6 treatments.
And I know, Dr. Lee, you brought some before and after pictures supplied by the company of what kind of results. Obviously, I think this appears after multiple treatments.
Well, that's 4 treatments. 4, 6
I mean, those are pretty dramatic changes.
Yes.
I mean, you can still see some laxity there that you can get out surgically, but for someone who doesn't want surgery,
this
pretty
is a nice
change.
option. Yes, I agree.
Part of the deal here, Dr. Lee has been so kind enough to agree to do a couple more treatments for you and get you in shape. I'm jealous. Thank you, Dr. Lee, and thank you, Kelly, for coming in. You're going to love it.
And now it's time to tackle the #1 body problem that all women hate. I'm talking about the dreaded cottage cheese, otherwise known as cellulite. Right, Dr. Orden?
Well, absolutely, Travis. And I'm here with Dana and her plastic surgeon, Dr. Matthew Schulman, clinical professor at Mount Sinai School of Medicine. First of all, what is cellulite? You started by saying it's cottage cheese. Well, I call it fat that's gone wild. We don't know exactly what causes it, whether it's a circulation problem, a metabolic problem, but it's changes in the fat below the dermis, primarily in women, that causes that dimpling, uneven look, that lumpy, bumpy look on women's legs. Dana hated her cellulite so much, she decided to try out a new treatment that uses radio frequency waves called reaction.
Right. I'm going to start the treatment here on Dana, and what's really exciting about this system is it uses radio frequency energy, so it's heating up the tissue, it's softening up the septae, or the fibrous divisions between the fat, which is what gives people the appearance.
That retraction.
Right. And what's new about this technology is this is the first and only approved system that uses adjustable radio frequency.
Okay, so that's a difference from the other radio frequency treatments that we've done. Now, Dana's already had 6 treatments.
Correct.
This is an ongoing series. It's not just a one-shot deal. You have to come in multiple times.
Correct. It takes, for cellulite and fat reduction, I generally recommend 6 treatments done 1 week apart. And then sometimes people come in for just maintenance therapy every 3 months, 4 months. So this is Dana's final treatment. And as she'll tell you, this is a very comfortable, you don't see her flinching.
How's that feel? Do you feel a little heat there?
It feels great. It's just like a massage and heat. It's nice.
Oh, I love this. I love these painless procedures. Now, can you do this on other parts of the body?
This is great for anywhere on the body where there's fat or cellulite. So while today we're doing it on the back of her thighs, I can do it on the abdomen, the hips. The nice thing about this system, too, which is unique, is it not only does reduction in cellulite, but it also can do skin tightening. So non-surgical facelift, non-surgical neck lift in the man or woman who has early signs of facial aging but is not ready financially or emotionally for a surgery. This is a great option.
And I think that's the biggest thing that we have going on in plastic surgery now are the non-surgical options. We have an animation that shows exactly what is going on below the skin in terms of what these radio frequency waves are doing here.
The key here is, as you can see, is because this is tunable, I can adjust this radio frequency and I can really specifically target the depth that I'm trying to. If I'm trying to target deep fat, I can adjust the system so that it's going to that deep tissue. If I'm trying to do cellulite, which is more closer to the surface, I can just target the surface. So I can treat deep areas without having to turn up the energy. So the safety profile in this system is great, less risk of burns or pain to the patient.
Well, I think it's time that we see how Dana has done after these 6 treatments. So let's take a look at her before, focusing in on those back of her thighs and outer thighs, correct?
Correct. We targeted the hips and the back of the thighs, and you can see that there's a much smoother appearance on the after. Obviously, you know, Dana started out pretty good in the before, but the studies have shown that you can get a 55% reduction in the appearance of cellulite. So if you're starting out with just a little bit of cellulite, 55% is still 55%. Right. So the improvement's really going to vary depending on how severe the cellulite was to start.
As we explained, not just on the thighs, the buttocks, other applications because you are tightening skin as well. Let's take a look at these.
This is great for the arms. As you know, arms are a really tough area. Liposuction tends not to work so well in the arms because you have that loose skin, but this is skin tightening on the upper arms. And I think you get a really nice improvement. It's certainly not surgery, but it's great, and the patient was happy.
Most importantly, what do you think, Dana?
I love it. This summer was so exciting to not have to put a cover-up on when I was at the beach.
Ooh, it's all about being able to get into that bathing suit, right?
Mm-hmm.
Well, Dr. Shulman, great work.
Thank you.
Thanks for coming. Thank you, Dana.
Thank you.
A happy camper.